I'm now going to demonstrate my general elbow examination. So let's assume our patient has already given us a full subjective history and there were no complaints of either radicular pain, possible myelopathic pain, or referred pain. If there were, we'd perform a full upper quarter screen and rule out that condition. So let's say that's already ruled out, and let's go ahead and do our active range of motion at the elbow. So let's start with active range of motion into flexion. So come on over here, and let's flex up all the way. Any pain with that? Good. And now let's go into full elbow extension. Good. Now I'm not doing any overpressures here because we're going to cover that with our passive exam. So we'll then do pronation and supination. So arms to the side, pronate fully. Good, and now supinate fully. Good. You'll probably want to use different terminology describing this to your patients, but since my patient is also a physical therapist, this makes it a little bit easier. So we then want to do our passive technique. So we want to start with elbow flexion. Any pain with that? Okay, let's go into elbow extension. Good. Any pain?
No.
Okay. We're now blocking here with our elbow, keeping their arm by their side, and pronating. Any pain?
Nope.
And now supination. Any pain? Okay. We can also passively stretch the wrist extensors. Now we're looking for pain potentially at the lateral epicondyle. And the wrist flexors. Possibly pain at the medial epicondyle. And that's our active assessment and our passive assessment. So now let's move on to our accessory exam. So let's have the patient sitting with the arm up here. We're going to now do an anterior to posterior mobilization at the ulna. Okay, so we're flexing the elbow, using our thumbs just right on the ulna, and performing an anterior to posterior mobilization. Again, we're assessing for concordant symptoms. If pain is detected, we want to perform repeated motions to either see if the pain is increased or decreased. All right, that's for the ulna. Now we want to assess the radial head. So I'm going to position you in about 90 degrees of elbow flexion. I'm going to perform here a medial to lateral glide at the radial head using my thumbs here. So use a dummy thumb grip. A medial to lateral glide is the accessory motion that occurs when pronation is happening here at the elbow. Just like that, assessing for concordant symptoms. Now I'm performing a lateral to medial glide. This is the motion that occurs with supination. So right on the radial head. Good. Again, assessing for concordant pain. That is our accessory exam. We then want to move on to palpation. Now you want to palpate anything that you think may be indicated up to this point. This could be either palpation at the medial or lateral epicondyle, the radial bifurcation right here on the dorsal forearm, the cubital tunnel for the ulnar nerve, whatever you think is appropriate at this point. So let's assume that's done and go on to manual muscle testing. So have your patient stand up. Okay, let's start with elbow flexion. So we want 90 degrees right here at the elbow joint, and resist me here. Good, and again we're assessing both sides here, but for the purpose of this video I'm just going to do one. Elbow extension, so push down. Good. And for pronation, we want to put the patient in full supination. So I'm going to say resist me here. Resist, resist. Good. Try to turn your hand over. Good, and relax. To assess for supination, we want the patient in full pronation. So again, resist me here. Push out. Good. We then want to assess wrist flexion and extension. So I'm going to just kind of grab my patient like this. Don't let me push you up here. Good for wrist flexion. And for extension, come on up. Don't let me push you down. Good. And that's manual muscle testing. So now all that's left is our special tests. Now you want to select your specific special test at this point because we want to rule in the condition with a positive result. So refer to our special test section on the elbow for more information. And that's our elbow examination.